So I
Yep.
think we'll go ahead and get started.
Sure.
I I just want to obviously everybody knows kind of where we're at and why we're here. Um, as Mike Burns said, Mike Wade and I jumped on this and reviewed, I don't know, upwards of 20 different proposals that we received in response to our RFP. Um, and really, given the timeline of the way this all went down, our priority was to find a plan, a fully insured plan that was as consistent as the plans we currently offer, knowing that potentially down the road we might want to make some other changes, but for right now to make any sort of drastic change, we just simply didn't have the time to do that and get everybody transferred over without running the risk of people's coverage being disrupted or people not being able to adjust to whatever those differences were. So Mike was one of two, maybe three contenders. Oh geez, told you about my dogs. One of two contenders that we decided to investigate further, and the benefits of going with Mike and CGI was just that they're local, they're based out of New Hampshire, they understand school districts such as ours. We were impressed with their responsiveness to all of our questions, which were, gosh, uh numerous. That's like such an understatement, thousands of questions. um and so we just really felt like, while other plans presented to us were comparable to this one, it was really about Mike and his team, that led us to CGI, because of the kind of care and individualized attention we think they'll bring to our staff. So, virtually this plan is identical to what we have right now, with some added benefits, larger network, a variety of other things, which Mike will get into more detail about here in a second. But that's how we landed on CGI. The past couple of days, as we've been meeting with retirees and with Mike and his team, both on site and via Zoom. And then today they offered up, 3 hours of drop-in time for folks to come in and ask questions and complete paperwork and things. We're now certain we made the right choice as far as that goes. So I'll turn it over to Mike. Mike Wade is also on this call. Should we have other questions for him? I'm still here to answer any additional questions, and certainly if there's questions we can't answer right now, we'll have the answers for you, in the morning. I'm recording this call so we can post it on the website. All of the information that will be presented is, I think, already on the website. And then we'll have some plans to communicate to you all about how to stop by and grab your paperwork and all of that other logistical stuff. So unless anybody has questions right now, we'll go ahead and turn it over to Mike to get started.
Yep. Great. Thanks, Amy. I'm just going to I'm just going to pull up my our presentation here. We had two different presentations we had been working on. One of them was for the Medicare population, and one of them was for the active. So I just want to make sure I have my correct presentation up here for you folks. So bear with me for 1 second. I thought I had it up, and there we are. Okay. Sorry about that. So again, I'm Michael Burns from CGI. CGI is a employee benefits agency. We are headquartered in Auburn, New Hampshire, and we have offices up in Scarborough, Maine, as well as Beverly, Massachusetts. We have north of about 100 employees, and we're unique in the different types of support that we provide the clients we work with. We're fortunate at CGI to work with just north of 1,000 clients of different sizes, everything from schools to restaurants, manufacturing, etc. And we were so honestly thrilled to be able to work with SAU 9. I shared with both Amy and Mike. My family, we spend an awful lot of time. We have a family place up in North Conway, Albany, technically. And it was important to me because this is kind of where my family is a lot. And we wanted to make sure that we were doing everything we can to support the school districts for all that you do for our kids and for the community. Today, I'm going to walk through a high-level overview of the plan that is coming into place as of July 1st. I will say that I was very impressed with the support that Anthem Blue Cross Blue Shield of New Hampshire provided to the disruption of NHIT, and they were excellent with their partnership of helping us through both, changing of plan designs and negotiations and so on. Today, we're going to talk about the high level aspect of the health plan, some wellness programs, tools, and resources. And whenever I go into the open enrollment type meetings, I've been in this industry now for over 30 years. My background's in nursing. I worked in the old days of Harvard Community Health Plan, which is what Harvard Pilgrim Healthcare became. It was the clinical site that I was at, and the Pilgrim Insurance that morphed together to be what Harvard Pilgrim is today, which is what NHIT uses for their network, for their back end claims processing, and so on. And I have a very deep knowledge of the clinical aspects of the program, but also on the operations. I worked in medical management, disease management, and over the years, spent a lot of time working for them, for Tufts Health Plan, who's now a partner with them, Anthem Blue Cross Blue Shield, and ultimately CGI. So as we go through this, I'm going to hone in on things that I think that are really important for you to know. And after this meeting concludes, I know that Amy had mentioned we're local. We were up here, the past couple days. We're going to be back up Monday, Tuesday, Wednesday next week. This is not, we're not shopping right now for a vacuum. We're not shopping for a car. This is health insurance, and this is a big deal. For a lot of people, you know what? If you don't have much going on medically, great. You're gonna, we're gonna update your information. You're gonna get a new ID card, and life goes on. But if you're someone who's in the middle of treatment, cancer, you got people coming to your house, you have an upcoming surgery, this can be very overwhelming. And let me just start by saying, like, we're here to help you through that. I don't want anyone getting, losing sleep and getting worried about what's to come. That's why we have the partnerships we have. I'm going to work through everything. If you have a personal situation that's going on, call me. If you have a situation going on, hey, I just want to run something by you, stop by. We're here. And that's what our role is. So again, sky's the limit as far as info, and any information you're looking for, I'll hunt down if I don't know. And hopefully over the next several years, we'll have a long-term relationship, CGI with SAU 9. And you'll realize that, we're very focused on member knowledge, on you understanding your plan, of you paying as little as possible when you both pay for your portion of contributions and for when you access care. So with that said, let's jump in. The benefits enrollment, as you know, this generally is considered an open enrollment period. This is the one time each year where you can make changes generally to your benefits that you have available to you through SAU 9. Now, today we're focusing on medical only. You do have other benefits. You have dental, you have, life, etc. Those benefits will be spoken to at a different time. Right now, given the situation, we're going to kind of focus on this. And with that said, when it comes to new hires, as many of you know, if you're a new hire, you need to elect your benefits within 30 days of your eligibility period. You are eligible the first of the month following 30 days. The qualifying life event, that's referring to things like having a baby, getting married, adopting a child, becoming Medicare eligible is also a qualifying life event. So when you have one of those things happen during the year, it's important to remember that you have 30 days from that event. For example, if you get married on March 2nd, you have 30 days from March 2nd to add your spouse to your plan. That is not a SAU 9 rule. That's not a CGI rule. That's an Anthem rule. And you also have to just keep in mind that once you elect your coverages, especially when it comes to medical and it comes to dental and vision, because these are pre-tax deductions, you can't elect them and then just drop them for no reason. The IRS doesn't allow you to do that. So just keep that in mind. Once you make your election, you decide to enroll in the plan, you'll be in it. Next open enrollment, you can decide to either renew or maybe go on to a different plan if there's another option available come next year. We're going to look at a lot of different things as we approach next year and really try to find as much choice as we can for everybody. The open enrollment period for now, July 1st, again, is the effective date. June 5th is when we kind of kick things off. And you'll be able to, kind of give it some thought and get your paperwork into us by June 13th at the latest. The reason why June 13th is important is, what we did was we went ahead and we were able to secure a file from NHIT with all of your existing information. So we have, names, dates of birth, dependents, those that are enrolled in the plan now. The reason why we're asking people to please complete an enrollment form is because data is so important to be updated. When we have fresh data, it makes all the difference in the world. And just to give you an example, when we went into this, I'll call it a little bit of a crisis mode of trying to make decisions on which broker to work with, and I guess Amy and Mike and the team, and what carrier to go with, and setting these meetings up. There were a lot of early retirees, for example, that we just didn't have information for. So we're trying to set up meetings and they didn't even know this was happening. So the more we keep the data up to date, the better. So that's why we're asking people to please just update, add your personal email, add your cell phone numbers. We're not going to send you any sort of spam messaging or anything like that, but we want to make sure that we're giving you the information you need in order to reach out to you when something like this is important that needs to get to you.
Quick question, Mike.
Sure.
So I kind of heard two different things. I
Sure.
heard you got a file that says you can roll over the data,
Mm-hmm.
and then I heard you say you need us to fill out an enrollment
Yep.
form.
Yep. Oh, Jim, yeah, thanks for asking the question. So we have a download of data of folks that were enrolled, as of a month ago. What
Yep.
we're going to do is take the enrollment forms that you're submitting now, and we're going to cross-reference it on the data that we have. We're going to make sure that everything is up to date with addresses, phone numbers, emails, and so on. And then that file is what we will transmit securely over to Anthem and what will be uploaded into their system. So
Okay.
we're just trying to make sure that instead of taking what is, which we know isn't accurate, there's always people that have changes. We're trying to make sure that the data we are starting off with Anthem on July 1st, having as data that's as up to date as possible on everybody. And again, it's just making sure that we're just doing that check of making sure that we have the right data for everybody moving forward. So that's why we're asking for the forms.
And just so you know, and Amy or Mike Wade, um, I'm not computer savvy, as everybody knows.
Mhm.
But I found, the letter and then the schedule for these meetings. And Mike actually posted the rates for July 1st. The
Mhm.
one thing that I didn't find was the enrollment application form on the SAU 9 website. So
Yeah.
I don't know if
Jim, your time. I feel like I need to send you a gift for this because everything you're asking is great because these are things that actually changed some of it today. So what we found is that initially we had distributed the Anthem application, which is quite cumbersome. Anthem sells medical, dental, vision, and it
Sure,
created a little bit of confusion.
sure.
So what Mike did in the team today is they have a form that replicates the NHIT form that is now the Anthem form, and that is on the website as of today. So
Perfect.
that has been updated with the summary of benefits. The PowerPoint that we're going through today will be on there, as well as the summary of benefits, etc. So we've been refreshing that as we've gone along here, and the form should be there now, if not mistaken, but if not, it's imminent. But great point, Jim.
Perfect. Thank you.
Thanks. So the health plan itself. So for starters, I know today that there are like three different versions of your plan. There is we call these chassis. There's an HMO, there's a point of service, there's a PPO. Some of them have in-network only, some of them have out of network. I know that some of you are early retirees and maybe you're still living locally, but maybe you're not. Maybe you're in Florida, maybe you're in another state in the country, or maybe you're someone who has children like I've had that have gone off to college. And that becomes an exception process on the plan you're on now, because especially if you're on that super HMO 1500, because it's really a network that's limited to a few states. One of the changes we made to moving forward July 1st is that instead of three plans, there will be one plan. This plan, the chassis, is a point of service plan, which is the same as a PPO plan. The network that all of you will have now is national. You will have the Blue Cross Blue Shield network, whether you are in New Hampshire, Maine, Massachusetts, California, Florida. Everybody has the National Blue network, which is, if not the top two largest networks in the United States. So what does that mean? Number one, you no longer need a PCP listed as being your provider. We certainly want you to have a PCP, but you don't need to tell us who it is anymore. You don't need specialist referrals anymore. If you live in New Hampshire, and I was talking to someone today, they were talking about a neurologist they've been trying to see down in Boston. Not an issue anymore. You just refer yourself. We always want you to involve your primary care physician and, utilize their recommendations, but you make your own appointments now. There's no more, I need to talk to my PCP before they refer me to wherever. You have your ability to have that access to the full national network. That means you want to go to Boston, you want to go to wherever, as long as it's a Blue Cross provider, it's in your network now. So again, national network, no PCP, no referrals. There is virtual care. I know a lot of us unfortunately became more familiar with that during COVID, and I'll talk more about that a little bit later. Coverage for preventative care. I can't emphasize enough how important it is to get your routine physical exam. You and the district pay a lot of money for health insurance, and it's important that you're going in and you're getting your routine physical. It's an hour once a year. We encourage everyone to do it. This includes all your screenings, mammograms, pap smears, colonoscopies. They're all covered as part of your preventative care, same as they are today. Prescription drug coverage we'll talk about. That's all with Anthem as well. There's your benefits for urgent or emergency care, no matter where you are, whether you're local, you're traveling, whether you're out of state or you're out of the country. And there's a lot of health and wellness tools I think that will be very helpful. I love Harvard Pilgrim. They were a great company. They are a great company. And a lot of the tools they have are good. When you see some of what the technology and the capabilities that Anthem has, they're quite impressive. And I think that this will make access to your information a lot better than it's ever been. So we'll
Hey,
share
Mike,
more as we go through this.
I got a question. Preventative care.
Sure.
Would that also like include like allergy shots and things like that?
And that's a great question. So every carrier follows generally your preventative care services. So if you think about preventative care, it's your the way I always describe this, to be honest, is it's sort of like a bridge. There's a number of services that are considered screenings when we go in for our routine physical. So again, we talked about mammograms, pap smears, but there's routine blood tests that check for whether or not you have high cholesterol, whether or not someone has a high blood sugar, whether or not someone has, their blood cells are off. Those screenings, those tests are all um, are basically all explained and provided by the carrier. So Anthem has a list of all their preventative services. When it comes down to someone that has a treatment, and let me give you an example. I described the bridge. When you go in for your routine physical, on one side of the bridge is everybody, right? And we go in and we're getting checked. Do we have a high blood sugar? Do we have high cholesterol? Do we have whatever? Those are screenings. I personally have high cholesterol. I take a statin every day. When I go in for my routine physical, my cholesterol test is no longer a screening. I have high cholesterol. I'm on the other side of the bridge. Who's on the other side of the bridge with me? Anyone who's diabetic, people who are on blood thinners, people that are on thyroid medications, people that are on other seizure medications that require blood monitoring. The screening of preventative care is virtually a screening, a do you have. Once you start getting treatment for something like my medication, or maybe you in your example of maybe receiving allergy injections for immunotherapy, somebody goes in for a mammogram and the mammogram's clear, everything's great, covered in full. They go in for the mammogram and they see something they don't like and they're like, we saw a shadow we didn't like. We want you to come back in 3 months. You're on the other side of the bridge with me. Women going in for pap smears. Everything's clear, great. Oh, we saw squamous cells. Next one, deductible. So that's where you cross the bridge. So what I generally say about preventative care is the list of preventative care is pretty standard. When you cross that line of needing a treatment or needing monitoring, medication management, you are no longer in a preventative phase. And that's not unique to Anthem. That's every health plan in the country. That's no longer a preventative service. You're now being monitored, checked, or treated. That's when it flips to more of a deductible service. So does that help, Mr. Murphy? Okay.
Yes, it does.
All right. Great. All right. Thank you. And again, if people have unique situations, I can certainly we can talk about it offline for sure. When it comes to the health terms, just again on this one here, we use a lot of terms, a lot of acronyms when it comes to our insurance coverage. The deductible is the amount of money that a member pays for services before the health plan kicks in. On your plan, you have a $1,500 deductible per person, $3,000 is the family. The $1,500 is considered the deductible, and we'll talk about the funding of that in a moment. Once you hit that deductible, there then on some plans, on yours, there's a coinsurance. The coinsurance kicks in, which is 20% of the services after you've met that $1,500 deductible. And that 20% continues until you hit the out-of-pocket limit. Now, on your out-of-pocket today, your plan, we have a deductible of $1,500, $3,000. You have 20% coinsurance thereafter for everything, except for medications. That's 10%, and we'll cover that later. But I want you to think about, for you and everybody on your plan, you, your spouse, your children, everyone on your plan, imagine that every one of you have an imaginary bucket in front of you, 5-gallon Home Depot bucket. Every time you put $1 and you pay it towards your deductible, it goes in your bucket. Every time you pay 20 cents on the dollar for your coinsurance, it goes in your bucket. And the way that your out of pocket works is that when your deductible in your coinsurance for you reaches $2,000 in a year for an individual or 4,000 for a family, a lid goes on your bucket, and anything you need related to your health insurance for the rest of the year is zero, costs you nothing. I will tell you that your out-of-pocket limit of 2,000, 4,000. I've been in this industry for 31 years now. I graduated nursing school in 95. You have the lowest out-of-pocket limit that I have seen at least in a decade. And what I mean by that is the federal government are the ones that manage that, and they're the ones that say the out-of-pocket can go up, up, up. The highest out-of-pocket right now for this year is $9,300 for an individual, $18,600 as a family. So when you think about if you had that same 1,500, 3,000, if you had an out-of-pocket like the government allows employers to offer, your 20% would continue for a very long time. Your worst case scenario is 2,000 per person and 4,000 per family, which is and again, one thing you learn about me is transparency. I tell you like I see it. It is absolutely phenomenal, and that protects you and your families because unfortunately, sometimes people really get sick. And imagine if you had to pay 20% to 9,300 or 18,600. Yours is 2,400, which is phenomenal. Now, the health reimbursement arrangement, I do want to take a minute to explain this, and I promise the rest of this will go a lot faster. So the health reimbursement arrangement, a health reimbursement arrangement is a pool of money. It's a budget item for every employer that wants to help their employees fund and help pay for things like a deductible or coinsurance. For plans that have copays, sometimes they can help with that, but generally it's deductible coinsurance. When you were with NHIT, well, you're still with them now through the end of June, you have an HRA that if you watched the video, if you took the test, you earned money. It was $1,000 for an individual and up to $2,000 for a family. And that was something that was funded by NHIT. That is an absolute anomaly because normally the ones that fund that HRA are the employer, which in this case we're going to say is SAU 9. So theoretically, when you think about the interlocal trust, them funding this is outside the norm, but they did it. The other part of that is that normally when an employer has an HRA, even say your plan $1,500 deductible, the first $500 in your methodology is always the employee. The employee pays the first $500. The HRA is on the back end. Yours is completely upside down. I made 3 phone calls to 3 different people to verify that this was accurate because it was so outside the norm. On your plan, the deductible of $1,500, the first 1,000 is paid for by the HRA. You pay the back $500. Now, when it came time for us having conversations, me having conversations, with, Dr. Frechette and Mike and Jackie and the team, that was a big number because as of July 1st, NHIT is no more. That HRA in theory would have gone away. What they decided to do was to find a way to fund that HRA so it continues July 1st through next June. And the same logic of the HRA paying the first $1,000 for an individual, $2,000 for a family. The difference is, again, we know that this has not been the best renewal for all of you. They decide, you know what, not only are we going to put that money in, we're gonna pay it. is that no one's going to have to take a test or listen to a video other than listening to me today, I guess. I guess maybe you should get double for that. But the process is going to continue. There's going to be no videos. Anyone who's enrolled in the medical insurance is going to get this. Somebody asked today in one of the meetings, they said, well, is that going to continue like in the years in the future? I don't know. Let's kind of get through this year. And I will tell you in full transparency, and again, this goes back to what I said earlier, I'll share whatever I can with you. This bucket of money for you is $500,000. It's $500,000 is what the people who had taken the steps to check those boxes, it's a lot of money. But the good news is it's going to continue. So Combined Services is the administrator of the HRA now. That is going to continue. We're going to continue using them. I mentioned today in the meeting that Combined Services, a lot of people don't know this, they're owned by Delta Dental. They own Combined Services. We are also fortunate to be the consultant brokerage for Delta Dental as well. So we work very closely with CS1. So they will continue to manage the HRA. Those of you that have the flexible spending account, that's going to continue being managed through them at this point in time. The good news is the HRA will continue. And that's a big, to me, that was a mighty undertaking of the SAU, but I was glad they did it for everybody. So a couple things before.
Mike,
Sure.
real quick. Well,
Sure.
First of all, Al Jones said, and Mackenzie, Meredith, they always told us those cards undermined the whole philosophy was of this plan was to have some skin in the game.
Right.
When they gave you the cards, the skin in the game didn't go away, but it was really diminished.
Yep.
Will we be getting new CS1 cards, or will we use the same ones?
It's a great question. So you'll be getting new HRA cards because the funding will change because it's now being funded by the SAU versus NHIT. And Jim, I couldn't agree with you more with what you just said. And just on a side note, one of the things when we knew that NHIT was kind of coming to a close, we actually hired Mackenzie, we hired Brittany White, we hired Sue Sullivan, and we hired Amy as well, who is the one that does a lot of the billing for the NHIT today. So all four of them are now currently CGI employees. And that was important to maintain the understanding of your plans. And that was an investment that Dan Cronin, our owner of our company, thought was critical in order to try to make sure that we understand your plan and the logistics as best we could. So that was, that was great. But new cards on the HRA, I would not destroy the cards that you have. I would keep them for now. The one question I have into CS1, some of you have a flexible spending account now. That FSA that you have, my guess is that will continue to function as that card, and the new cards will be used for HRA moving forward. I will circle back with the HR team at SAU 9, and they will share the specifics on that. But it would ideally it would be a new card moving forward for the HRA. Now, just the one thing I would ask everybody is the HRA that you have today that's funded through NHIT, they're going to continue funding whatever claims you have through the end of June. And then you will have 90 days after the end of June to submit those claims to NHIT and or to CS1 to be the responsibility of NHIT. Some of you have other allotments of money through district CBA agreements, I believe, or something to that effect. My recommendation to all of you is submit whatever you can as quickly as possible, within the 90 days, but certainly as soon as if you have a visit on June 30th, submit whatever you're required to send as soon as you can, get that money. Just to make sure that you're receiving what you are entitled to. beginning July 1st. It's a brand new HRA. There's not going to be a carryover every year. That's another thing that was very different. The HRA is something that is it renews every year upon renewal. So if you have any upcoming services you were thinking about, now might be the time to get those done before the end of this month so that that money can be used up within the existing HRA so that you're not tapping into your new HRA come July 1st. So food for thought anyway. So the point of service plan I mentioned, again, PCP relationships, extremely important. I'm a huge, huge pro PCP guy. I love PCPs. They're the quarterback. They're the ones that can help you around the system. With that said, you now have the flexibility to refer yourself if you'd like to, get a second opinion. You have that ability with your plan. For the medical and pharmacy comparison, this is just a high level to share with you. A comparison of the New Hampshire Interlocal Trust HMO OA Super 1500 with the more regional network where PCP referrals versus the Anthem plan. The national network, no PCP, no referrals. You'll see the way that the plan works is very much the same. You have your deductible going towards the same things, 1,500, 3,000, 20% thereafter. The out-of-pocket maximum, again, the bucket that I talked about earlier, 2,000 per person, 4,000 per family. If I'm on a family plan, you'll learn more about me again over the years, but I have 6 children, 4 on my plan still. So if I'm on your plan and I happen to get a lot of medical services needs, I'm done at 2,000. I got my $1,500 deductible. I got my 1,000 for my HRA. I paid my 20%. I paid the other 500 on the deductible. Once I hit that 2,000, I'm done. I don't go to 4,000 because I have a family plan or because my wife's on my plan or because my wife and kids are on my plan. It stops at 2. And then if my wife and my kids and their buckets together, even if I had, 600 or 700, they had 3 or 4, and together as a family, we had 4,000, we're all done. We get lids on all the buckets across the board. Preventative care, we talked about 100% covered. Again, just, keep in mind if you're someone like me, those types of services like cholesterol screenings when you have high cholesterol are a deductible charge. All of your other services, it's easy to understand, 20% after the deductible's met. Pharmacy is 10% after the deductible. For your pharmacy benefits, the medications that Anthem covers, their drug formulary is extremely large, just like the one you have now. When we talk about a drug formulary, what is that? It's the list of meds that they cover. It's every carrier, it doesn't matter whether you're changing from Harvard, we'll call it Harvard, even though it's NHIT, going from Harvard to Anthem to Cigna to Anthem. There is always going to be changes in where a drug falls, whether it's covered, not covered. It might be tier 2, it might be tier 3. And also, please keep in mind that existing carriers, Harvard Pilgrim, Anthem, all of them, every single year during the year, they have formulary changes that happen. So formularies do differ. Now, a lot of the generic drugs that, 87% of the people generally take, those are always falling in your lower cost tier 1 drugs. As the drugs increase in cost, so does the cost to you. That is basically the way that every drug formulary, every carrier works. Your more expensive drugs go on the higher tier. Your less expensive drugs go on the lower tier. One thing that is unique across all carriers is that some medications do require prior approval. You've heard the term step therapy, prior approval, dispensing limits, things like that. I always remind people, again, maybe it's the clinical side of me, is that prior authorization is not meant to torture your lives, although it feels like it, quite frankly, when you're going through the process. Is you go to the pharmacy and you find out that, oh no, we need more information from your doctor. it's frustrating. And I've been in that boat more times than you can imagine. Of my 6 kids, 4 asthmatics. So that goes to show you, it's like we have our own pharmacy in our house. So this happens a lot. But I will say there have been times where the pediatrician for one of my kids or my doctor, they write a prescription for me. They don't know what falls on what tier for every carrier. Harvard Pilgrim has 7 different drug formularies. Their national, they have their value, they have their core. Doctors don't know that. So I went to the pharmacy one time picking up an inhaler for one of my kids, and it was $150 for a rescue inhaler. I'm like, are you kidding me? It used to be $10. So anyway, the doctor's like, well, I just wrote it for, they have this new drug out, the blah, blah, blah. And I'm like, well, I didn't take the drug from the pharmacy. We ended up getting an equivalent drug that did the same thing for $10. It wasn't my doctor like trying to make me pay more. They just don't know. So sometimes prior authorization, it helped me save money in that scenario. And we were perfectly fine with that. With that said, I know that this transition is never fun. So one of the things that I had asked Anthem about was, as we transition, for those that have, Harvard covers the drug, Anthem covers the drug, but both carriers, for example, may require prior authorization. Prior authorization is telling the doctor or the nurse practitioner, whoever's prescribing it, like, hey, can you just give me a little more info why you're prescribing this med? It's not every med, it's the high cost meds. So to alleviate the hiccups, I asked Anthem to give us an approval for 90 days that if any of you are on a medication that you're taking today that does require like step therapy or prior authorization with Anthem, they're going to override it for you. The only one that I can't override, or that I can't say I can't, that I know I couldn't get overridden, which I understand is dispensing limits. So a dispensing limit example is sometimes people are prescribed a sleep medication, Ambien. You're being told that, Ambien should not be taken more than 7 days per month. The systems, the pharmacy benefit managers, so like the Optums, the Carelon, the Caremark, they build that safety system in their systems, as do all of the pharmacies that we work with every day and we go to. CVS, Osco, Rite Aid, they have all these mechanisms built in because, not a shock to anybody, providers make mistakes, right? Sometimes they don't realize that a medication should only be taken 21 days a month instead of 30. So if you're on a medication that Ambien, for example, where 7 days a month is the norm, there could be a very good reason why you get 30, and that's totally fine, but that one's going to flag. And then the provider's going to have to say, hey, here's the rationale behind my the method to my madness as to why I'm prescribing it this way. And they need to verify that because that's a safety flag. That's not like Anthem saying, I just don't want to cover it, or Harvard saying, I don't want to cover it. So we're trying to make this as easy as possible. If you have prescriptions that are not covered, definitely talk to your providers. But generally, there's a lot of overlap in the formularies between the drugs. There is a mail order program. So with Harvard Pilgrim, you use Optum. Optum is owned by United Healthcare. Some of you may know that, some of you may not. That is also the network that Harvard Pilgrim uses for those that had been on the point of service or PPO plan, or maybe you were on the HMO plan, but you had a child going away to school somewhere. Harvard would allow you to see those United providers. They also were the ones that managed the pharmacy benefit management behind the scenes. With Anthem, they own their own PBM. It's called Carelon RX, just like Express Scripts or CVS Caremark. They're the ones that design the formulary. They're the engine behind the pharmacy. With that said, they are the ones that manage the pharmacy for mail order. Their pharmacy for specialty medication. They do everything in Anthem. Anthem is very diversified in what their offerings are and what their capabilities are. That said, if you want to use the mail order plan, you get your 90 days. Somebody asked today, well, I get 90 days through my local pharmacy. Sure, if you have the 90 days there, you can fill it there for sure. I would always compare it to the Carillon in this case because it might be cheaper to go the Carillon route, but it's up to you. The 70,000 pharmacies, I would argue, is closer to 80,000. This is your CVS, Rite Aid, Walgreens, you name it, they're in. Anthem's the largest carrier in the Blue Cross Association. The network is all over the country when it comes to pharmacies. The HRA I talked about earlier, again, my advice, if you have existing funds, just know that you have until the end of June to utilize those. You have 90 days to submit for reimbursement. If you can spend it down while you can, that'd be great. If you can, I think it would benefit everybody. Personally, it was not going to benefit the SAU. It's not their money. It's not going to benefit, me or anybody else by any means. It's just, if you can spend it down instead of losing it, try to use it if you can. So the health and wellness programs, this will be relatively brief here, but one of the things about Anthem, having worked for a lot of carriers, Harvard Pilgrim, I mentioned, I worked for Tufts Health Plan, I worked for Mass General Brigham, I've worked for Anthem before I joined CGI. Of all the carriers out there, I will tell you that Anthem, their technology is sensational. And the reason being is they have an app. I know with Harvard Pilgrim, you can go online, you can enter the URL, go to the Harvard Pilgrim site or the NHIT site, log in, and you can get some information. With Anthem, you can download the Sydney app. It's called Sydney, and you can download it right onto a smartphone. If you have a Android, iPhone, etc. What's nice about their app is you can do literally everything from this app. You can, you ever go to a carrier's website and you're like, okay, I want to look up my drug, and you do the drop down and they have like 15 different drug formularies. You're like, I don't even know which one's mine. Or looking for a provider, the same thing happens. This puts everything in one spot. Your doctors with your national network is what you will see. You will see your drug formulary. You can pull up a digital image of your ID card. Stephanie Ciccarini, who is the Anthem account manager, she was here today. She was heading home, and she didn't join us today, but she'll be involved with a lot of this. She had said, like, for her family, she's the subscriber. She has, her husband's card, her card, all the kids' cards on her Sydney app. How convenient is that? You don't have to carry around 4, 5, 6 cards. Everything is digital. You will still get a card mailed out to your home, one for everybody, but it is very convenient. You can look at your claims. You can look at your explanations of benefits. You're curious to say, like, wow, I remember that meeting with Mike, and he said that durable medical equipment was wheelchairs and crutches and canes. And how much do we pay? Ask the question. Sydney is like your Alexa at home. There's about 25% of the questions you ask her, it'll respond back. Other times you'll be prompted to connect directly to an account representative at Anthem, and they can answer all those things for you. You can coordinate your online if you're using their telemedicine app. You want to go ahead and submit for health rewards, which we'll talk about. Everything is in this app. It is honestly quite impressive. And I think that for a lot of people, and someone had said today in one of the meetings, I'm not really tech savvy. This is not a tech savvy need. You just like click around. It is very easy. And there are also videos that Stephanie is going to send that will be posted on the SAU site. So you can learn how to like utilize that if you want to. It's not a you have to, it's an if you want to. But I can't tell you the number of times where I might have a question, something comes up from one of the kids or me, and I'm like, is that medication covered? Imagine being in your provider's office and being able to pull up a list to say, like, hey, order one of these meds for my high blood pressure instead of like randomly guessing. You have all that at your fingertips, which is phenomenal. You can download the app today if you wanted to. However, you can't activate it until you have your member ID number, and that will come after we submit that to the enrollment roster file to Anthem, and they will upload it and turn it around quickly. But figure July 1st forward, you'll be able to access all of your information about your Anthem medical plan and your pharmacy plan. For health and wellness, they have phenomenal programs. I'm going to jump into a couple of them here. Anthem has a health rewards program. So who does this pertain to? It pertains to you as the subscriber and also your spouse if they are on the plan. The way this works is that you and your spouse both can earn up to $700 each year. That $700 that you earn is then basically available to you in a digital like credit card, if you will, for Home Depot, Target, Amazon, etc. The way it works is you go in for your annual physical exam. You just got $20 for doing something that you know you should do anyway. You get your annual eye exam, which, by the way, on your plan, you have an annual eye exam covered every year. You're going to get $20 for getting your eye exam. You're in that happy range of 45 plus now for a colorectal cancer screening. You get 25 for that. Flu shot, you get 10 for that. You are earning money as you go. And on the app, you can do this. You can go in and just track your rewards, and you can earn up to $700. Now, Stephanie made a great point today in one of the meetings that, some of this stuff is automatic that a lot of us do. Some of you may want to track your steps. You may want to connect your Fitbit or your iPhone, your Apple Watch to kind of earn that way. But for some of us that, maybe we're at an age where it's age based on the services that we get, like a colorectal, like a colonoscopy, for example. There are certain things that as you get older, you'll be able to earn more, but the average person can earn generally between $200 and $250, quite frankly, for things that we're doing anyway. Right? You go on, taking the health assessment, those are easy. If you're a smoker and you want to quit, you get $60 for that. So there's all these things that you can do. Anytime we talk about health insurance, I always say to people, yeah, there's the premium we pay. There's the money that we pay when we access care. But what else is there? This is all of the what else is there that a lot of people forget about. So again, this is available to you, and it's also available to your spouse. Each of you have your own account. I used to always get the question from folks. They'd say, well, if I do all this stuff, is my husband going to have access to my, to my money that I earned? And the answer is no. You each have your own. So you can earn up to 700. He or she can earn up to 700. It's all your own money. That is something that is available to both of you and available through the app. The gym reimbursement is phenomenal. Now, the way that the fitness facility reimbursement works is that this is something that you do have to submit. It's more of a submission, more of a manual submission, but the way it works is you submit the form that says that you did belong to a gym. You show proof that you belong to the fitness facility and that you paid, whatever you paid. And you have to show, you get a visit log, and all the gyms and fitness facilities are used to this. Just say, hey, can I get a report that shows that I checked in, at least 35 times in a 6-month period? And the way it works is that if in fact you are going to the fitness facility, I joke a lot of times that, I join Planet Fitness and I drive by it every day, but I never go in. But if I went in and scanned my card, at least I'd be able to submit for a reimbursement. So if in fact you were to go and say you join a gym and it's $100 a month, for example, one of the more expensive ones, you go in, you show that you've gone 35 times in that 6-month period, submit that to Anthem. They'll reimburse you $200 every 6 months, up to a maximum of $400 every year. That benefit of the gym reimbursement is available to you. It's available to your spouse, and it's also available to any of your children, any of your dependents that are 18 or above. So again, you have a couple of kids that are over 18, under age 26 that are going to the club. If they're going to the gym and they're working out, maybe you're not. They can get the up to 400. You can either submit it every 6 months or wait till the end of the year and submit it. But it's a lot of money, and they're just a way that they can help you pay for some of the things, again, that quite frankly, you may be doing already anyway. If you're paying $10 a month at Planet Fitness over 6 months and it's $60, you'll get 100% of the $60. So it's up to the $200 every 6 months, but it's pretty great membership, reimbursement. And again, this one does not go through the Sydney app, but it's very easy to get reimbursement. Smart Shopper, I will actually give all of you accolades and applaud all of you, because all I heard about through all of these conversations about SAUs and municipalities, and I heard it from Harlow, which is the administrator of your current plan, is that SAU 9 is the best. They are the best. They're the best at, at understanding this program, how it works, and you were the top performer across the entire NHIT block on Smart Shopper. What is Smart Shopper? Smart Shopper is the program whereby maybe you have a lab test scheduled at the hospital. You go to an independent, Quest lab. There's a reward for that. If you had a surgery, you're having a colonoscopy done at the hospital, if it gets rescheduled to an independent freestanding surgical center, that is a Smart Shopper experience. There's a reward for that. The difference now will be that before you were getting like 20% of whatever that savings happened to be, that was through NHIT. The program now will flow through Anthem, so they will actually be the ones to send you that money. Usually, if you go in, you were scheduled for a service, you went and had it done at a lower cost location. When the claim processes, you will then get a check in the mail for whatever that amount is of that reward. They're flat dollar fees. It's not a percentage of savings, but that program does continue. And I would encourage all of you to please continue doing this. I will be honest again with all of you, is that, as brokers in the state, we get paid. It's always a question that people always wonder, but no one ever asks, except for Amy and Mike, they definitely asked. But the way that brokers are paid is that for Medicare members, we get $10 per employee per month, whether someone goes with one plan or another. With those of you on the active plan, we get on average, it works out to be about $28 per employee per month for each person on the plan. With that said, I'm never, there's no kickback to me whether or not you use Smart Shopper. There's no kickback to me, or CGI for that matter, whether or not you go and have your physical exam and you're doing all these things that we talked about. Where it matters is that, remember, you are a large group. You have over 250 people that are enrolled on your plan. Your claims matter. And people ask all the time, like, wow, our renewals, may seem high, or wow, our renewal was great. It's not rocket science in the sense of the numbers. It's carriers will look at this and say, SAU 9 paid X amount of dollars. We, Anthem, paid out Y dollars. Did we spend more than we took in? Did we spend less than we took in? Or, where are we in that scenario? It is like, it's more, I'm simplifying it, but that's really what it breaks down to. And the reason why I'm sharing this is, you going to places to have lower cost services, it comes back in our premium. You pay a portion of the premium. SAU 9 pays a majority of the premium. Every one of us that kind of do our part, you know what? There's nothing better feeling in the world for somebody like me that comes out and says, hey, we got a renewal. It's less than trend. It's below trend. We're coming in close to current. But like, the more that all of us kind of think about programs like this, it makes a difference in what's to come down the line. Nothing worse than going out and saying, hey, sorry, the benefits changed. we all can kind of help that process moving forward. So again, if you can find ways, I always say to people, lower a cost doesn't mean lower quality. We always say in Southern New Hampshire, where we're located, we have docs, we have surgeons that go to Elliott and CMC every day, and they also go to the Basque. You could be the same member treated by the same surgeon for the same procedure. And the difference between an insurance company paying the bill to CMC or Elliott, if something's $30,000 there, it could be 7,000 at Basque. Same doctor, same procedure, same everything. It's the overhead. And that's every insurance carrier. So all that stuff does come full circle. So, please continue what you've been doing with those programs. They are going to make a difference.
Mike,
Take
are those set in stone?
The refund amounts are set in stone by Anthem. So
Because
they're
let me just tell you what happens
Sure.
is, where we are geographically.
Mhm.
The next nearest medical facility, north, south, east, or west, is an hour,
Right.
give or take.
Mhm.
So when we would get a percentage of whatever the savings was,
Mhm.
it was worth your while.
Yeah,
But
I agree.
now, if I'm only going to get $150 for
Mhm.
going to a colonoscopy up in Berlin, and I look at what the gas mileage is on my truck, and it's an hour up and an hour back at least.
Mhm.
It people are going to. I'm just warning you.
Yeah.
You're going to see people
Mhm.
not do it.
Mhm.
Um,
Right. Yeah. No, I totally agree, Jim. And I guess this is the fortunate side for all of you, because your deductible is and your out of pocket is so significantly favorable, that you have such a low deductible, and your personal cost impact is is lower than the norm. So you're right. For someone who doesn't have a lot of like reward, there is less of an incentive. I guess the incentive is, all of us, especially all of you, are so experienced in, CBA negotiations. And, at the end of the day, the budget's the budget. And like, you can only push a budget so far. And to me, it's like all of us kind of doing our, and again, I get nothing out of this either, whether someone goes there or not. But in order for us to help control costs, in order for us to continue trying to, make sure, for example, that, that the SAU, are they going to have $500,000 a year kicking around to fund an HRA? I hope so. But if all of us do our part, even if it may not be a personal evident reward in hand, so to speak, ultimately it does come full circle, because it is the budget, right? So when you have the pool of money, however you divvy it up, whether it be a shift in contributions, or whether a deductible needs to increase or decrease, or copays go up or out of pockets go up, it's a challenge. And I would just say that, again, coming from someone who has no, like, I have no skin in the game in this whatsoever, other than I always think of it as, sort of like the retirees. The retirees now have an option to go with a plan like they have now, or to go with a plan that's a little different. And if they go with the little different plan, for them, it could be a financial savings. Maybe the district might save a little bit of money in some scenarios, but ultimately, every dollar saved is a dollar that goes to somewhere else. And ultimately, when you look at the amount of money that it costs to insure SAU 9, it's millions of dollars. And if you think back, if you step back out of it sometimes and you think about it, it's almost like it makes the eyes pop out of your head. Like, how can it be, $3-4 million just for our retirees? How can it be almost $8 million?
I completely
That's what it
understand.
is. But you're right. You're right. It's
I
going to be
get what you're
something we'll look
saying.
at.
I get what
Yeah.
you're saying. But when I'm sitting here at my dining room table trying to
Hmm.
decide whether or not I'm going to go to Bridgeton or
Hmm.
Berlin or
Yeah.
down to uh, Wolfboro for
Yeah.
that colonoscopy, and I'm
Hmm.
going to get $150 extra by instead of going up the street.
Mhm.
I think it's something I would just
Yep.
look at it for next year. And
Yeah, yeah, absolutely. Yeah, it's a good point, Tim.
I'm not worried
Yep.
about the tax rate. I'm going to tell you
Yeah.
that's not on the forefront of my decision making process.
Yeah. Yeah, no, I completely understand. And, right now, I mean, we're, because this is a fully insured plan, and just so folks know that, the difference between fully insured and self-funded, on a self-funded plan, the employer basically pays their own claims for medical and pharmacy. In a fully insured plan, you pay a premium and the risk goes to the carrier. Because of the timing, we, had to go the fully insured route. We are, of course, going to look at the self-funded route again, and that's where a lot of that creativity comes into play, where you can have a lot because we're factoring in all of that into the equation. So I promise that we're going to look at this every way we possibly can to try to, incent people to do, whatever we can to help control the costs at this point this year again, because we kind of got kind of blindsided, I guess we can say. The Anthem numbers can't change because it's their program for all fully insured groups, but we will look at it. I give you my word on that for sure. But it's a great point. But again, looking to control the costs, it's a delicate balance for sure. For sure.
I get it, but that's why it
Yep.
was so popular here.
Hmm.
Be, be,
Absolutely.
because
Hmm.
people realize that, okay, I am willing to travel that at least an hour one way for these
Hmm.
procedures because it's worth it.
Yeah,
And
right. Yep, exactly. Yep. No, you're right. It's yeah, personally it's a big difference. And again, hopefully we'll get back to something more I guess, more beneficial as time goes on. And
yeah,
this year again we're a little bit pigeonholed, but I completely understand your point and I understand it very well. So we'll definitely look at that for sure. Um just from a case management standpoint, just let people know too. Sometimes people need assistance with, you have COPD, you have end stage renal, you have cancer. Anthem has a phenomenal number of programs that can help everyone with helping to manage some of those conditions. So again, very consistent with what you have now. The My Health Advantage again, sending you messages about your health. If in fact they see something in the data that maybe you're due for a mammogram, maybe you're overdue for colonoscopy, it'll send you different notifications to say, hey, you might want to get this scheduled. So again, technology is definitely beneficial with them. The virtual telehealth, this is something that I know that a lot of people got used to when it came to urgent care. So with Anthem, Live Health Online is the program they use. It is available through the Sydney app, or you could go directly if you didn't have the app. But with this program, a couple things. You can use this 24/7, 365. You could be in any state in the country, and if you have something going on that you need assistance with, maybe you have a sore throat, maybe you have a cough, maybe you have conjunctivitis, you can outreach to a virtual doctor, and the doctor will connect with you in a matter of minutes, and they can also prescribe medications for you. The one thing that's going to be a little different for you is that from an urgent care perspective, is that there is no cost to you for this benefit. So there's no deductible, there's no co-insurance. It's $0. So for any of you that are traveling, or sometimes you might be traveling, maybe you need a medication refill and your doctor's office is closed, you could use that. It'll cost you nothing. The other thing is, on a specialty standpoint, I know that for a lot of people who have been to behavioral health providers, it is very hard getting a provider that is available. It is also very hard to, basically set up those recurring visits sometimes because we have a shortage nationally. You have a very large network with Anthem, just like you do with Harvard, but there is another layer on top of it through virtual telehealth. So Anthem has a behavioral health telehealth network that is another set of providers that can see members for depression, for anxiety. I'm not talking about an acute crisis where someone needs to be at the emergency room. But what I like about this and what I shared with folks in my meeting earlier was, one of my daughters has an eating disorder, and going off to school, her mom and I were scared to death that, she's not going to get the therapy, interaction that she's been getting for the past 2 years. We were able to connect with her with a behavioral health therapist virtually that she met with every week, that she was able to continue and do well with. And that was something on your plan will cost zero, in addition to dermatology, which I love. If you call up anywhere right now and try to get a dermatology appointment, good luck. You're probably looking at 2 months of getting in before they can see you. With Anthem, you can do that virtually, and it's free. Again, if you have something really involved, virtual's not going to work, but sometimes it's a rash, sometimes it's pigmentation on your skin. Those are the things you could use this for, and it doesn't cost you a penny other than you outreaching in your time. And then just lastly here, before we wrap up, just some helpful reminders and key points. The transition to Anthem, the effective date is July 1st. All eligible members can enroll. So again, there's no exclusion for pre-existing conditions. That always comes up somewhere along the line. Whether you're healthy as can be, or you're someone who is dealing with cancer, maybe you've had a transplant, or maybe you're on a transplant list. None of that matters. This is not life insurance. You're coming on this plan just like everybody else, no questions asked. But if you need help during the transition, please reach out to Anthem, let them help you. No one's going to deny you access to the coverage. It's just to help you transition through and get you on board. Please remember to share your Anthem ID number. Everyone will get ID cards mailed to your home. You got an ID card for you, for your spouse, for your children. Everyone has their own. It is not your social security number, but your card in the back has phone numbers and websites to customer service for behavioral health, for member services, etc. And please make sure you share that number with your doctors, your providers, pharmacies, so that they update their systems. And beginning July 1st forward, they start billing the correct company. If you're running low on medications, again, just a helpful reminder, please try to fill in your medications you're running low on before July 1st if you can. Sometimes you can't, but because we're approaching the July 4th week, sometimes, providers are on vacation or there's a backlog. We want to make sure that no one's going to run out of their medications, or you're having to pay for something for some reason. If you had a dispensing limit drug, for example, we want to just do all we can to pre-plan. The HRA I spoke about, just making sure you submit any claims you can before the end of June. You'll have 90 days to submit them through the NHIT program. The enrollment deadline, again, if you could have your forms in by July 13th, you can either scan them, email them directly to the SAU, and then we will get them from the SAU because I want them. They're going to go through and verify. We'll update the file. The file will go to Anthem, and your ID cards will trigger. And then lastly here, just your ID cards. I mentioned they'll come out mailed to your homes. If you have a larger family like mine, I know that when all 6 of my kids were on the plan, sometimes we would get 2 mailings. I may get, most of my family, for example, on Monday. The rest of the family may come on Wednesday, but just keep an eye on those mailings. The cards, please watch your junk mail. They do not come as Anthem ID cards on the outside, so just make sure you're failing them. Make sure you open it. It's likely your ID cards, and the digital cards are available through the Sydney app. And then again, encouraging everyone, download the app if you can. You can confirm your providers are in network now. We've sent the link. We'll make sure it's on the website at the SAU. You can track your prescriptions, claims, appointments, during the switch. Make sure you get everything coordinated as you move forward into July 1st. And then just again, lastly, just reach out to Mike and Jack and the team and Amy. They've been phenomenal to really to be there for everybody. And certainly we are at CGI. We're available. You have questions, that's what we're here for. So with that said, I'm gonna close this out, and I'll certainly answer any questions anyone has that they'd like to ask. And if anyone has personal questions, please, feel free to, give us a call or stop by next week, and we'll be able to help you however we can. Any questions that anyone has?
Hey, Mike, there was a question. There was a question in the chat.
Sure.
How do we know if our current meds require a prior authorization?
Yep. Great question. So one of the things that we provided was a PDF listing of the medications, but you also, there is a link that we will, if it's not on the website now, it will be, where you can go out and you can check your medications directly on the Anthem site. And when you go out to the Anthem site, you can put in the name of the medication. It'll tell you what tier it falls on. It'll let you know if there's any pharmacy programs associated with it. For example, does it require prior authorization? One of the things I love about the Anthem site that I'll share with you is I was looking at one of their medication today for one of the members that was in person. And when I went and looked at the medication, it did tell me that it did require prior authorization and so on, but it actually gives you the clinical criteria. What is that? It's the roadmap to be able to say to your provider, like, these are the things that need to be, that Anthem needs to be aware of in order for them to approve this med for me. So it's an easy access. You can look at it and say, oh yeah, and the person I was with said, oh yeah, I've done that, I have this. And I said, you should not have any issues. You've met the criteria. Just remember that the criteria does not, the information about you, the criteria that Harvard may have or that Anthem will have, it doesn't carry over. So you do have the grace period, but if in fact there is something more unique, all that information is available online.
And then there's another one. Do we enroll annual enrollment or just enrollment?
Oh, yeah, great question. So this is considered annual open enrollment, but you can just hit enrollment. Really, the purpose of the enrollment forms that we're asking everyone to complete this year is really just to make sure that when we send the data over to Anthem, like, we all know you're in open enrollment right now, that will matter more during the year when someone has an event happen, like having a baby. Right now, I'm focused on rather just having everyone's updated information. Personal email is important. We all know that for all of you that are still working, especially, that you have a work email address. But having a home one for us as well is helpful because, eventually, you may become an early retiree and you may move away, or it's just nice to have that fresh information. So demographic information, you can check annual enrollment, open enrollment. It's really the demographic.
No, Mike Wade, you can't be an early retiree.
Man, I've thought about it long and hard.
He keeps asking me when I'm going to fire him, and I keep saying, not ever. So,
Mike Burns, I know our prescriptions were, and I forget what it was. Like, it was like 0, 20, 30, 50, whatever it was. Is that, and I know that the brackets change in terms of what medications fall into the generic, but are those parameters generally the same?
So, Jim, just a great question. So, what I went over today for this plan is specific to those that are actively working and the early retirees that are still on the active plan. For anyone that's on the Medicare, so those, it's 10% of after your deductible for the medications. For anyone that's on the 65 plus, truly retired, you have Medicare AB. Those were the different meetings we had earlier. Is that Jim, where are you on? Are you
I'm not
on?
under six. I know I don't look it, but I'm
Well,
still
no,
on
actually, you do look it, but that's good. Yeah.
under
So
65 group. But
yeah,
so say that again. I didn't quite get it.
yeah. So on your plan now, like on the let me just pull up the comparison again on the plan design. Let me just pull this up here. Let me just go back to let me see. So on the plan now with NHIT, so it looks like that after the $1,500 deductible is satisfied and you have that 20% coinsurance, for pharmacy, that goes into the deductible as so after the deductible, that 1,500, you then have the next $500 to the out-of-pocket maximum, whether it be 20% through your medical services or 10% of the pharmacy. After you hit that 10% on the Anthem plan, there are no co-payments on the prescriptions.
Okay, so that is different from what we have now,
Okay, yeah. So that
right?
that might be an upside to the Anthem plan
I
because once you hit that, you're done. So you have co-payments now after the
well,
10%.
they're fixed dollar amounts
Mm-hmm.
that are, like I said, 0, 20, 30, 50. I forget what they were. And some
Okay.
had 3 tiers, some have 4 tiers. But I think if you haven't done that, I would be clear about that with folks because I think that's a change from what I believe from what we have now.
Yeah, the Medicare enhanced plans, which are the actual 65 plus retirees, those two plans had the 0, 30, 50, and then they had like a 5, 15, 35, 50.
Yeah,
That's different than these plans. These
right.
plans only have the 10%,
Sure.
and then after that. So I'll take that one offline and look into it because I I guess I'm not aware that there were co-payments after the because once you hit the max of 2000, the 2000's it.
That's correct, but I still think it was, and I could be wrong. I still think it was a fixed dollar amount that
Yeah, it is on the Medicare plans, the Med Enhance, and that's how those plans currently work today. But on this plan, it should be the 10%. But we'll double check, Jim, to be
and
sure.
no, and it's not outrageous. Again, it's just
Yeah.
people are used to a certain thing.
Yeah. Yeah. Well, if it is on this plan, there's no co-payments after the 2000, so it would be an upside. So that's for sure.
Sure, sure.
Yep. Great. Let's see. Do we have any other questions in the chat here? The form does not allow you to sign it. Can we just print? Yeah, absolutely. Yeah, that's fine. Oh, thank you, Mike. Yeah, printing it is fine. Yep. Yep. And I think that's everything.
And I sent a note to Amy, but Mike Wade and you guys did an awesome job trying to match for so many people between retirees and active employees. And this is health insurance is always a bone of contention with negotiations to come up with a plan that is so close to what we have now. It's pretty amazing.
Yeah, Jim, I appreciate that because honestly, we were missing you on many occasions in the past handful of months just because of your historical knowledge. But I do think that, we found something that was as consistent as could possibly be,
Absolutely.
if not even slightly better, right? But we're
Yes.
with somebody that we trust, that we know is not going to be volatile, ups and downs over the next however many years. And at the same time, like our partnership with CGI right now, I know is going to be one in which we can investigate other funding models because we recognize that this is an increase to folks' premiums, right? I mean, it is, no matter how you slice it, but it's certainly not as catastrophic as we had been told. So we feel good about that, but we do believe that there's more research to be done in terms of, providing people with better rates with the same, if not better coverage, that just takes a little bit more time. But right now, the partnership that we've created, I think we now have a resource in CGI, and they have lots of networking. Even what Mike said about acquiring, many NHIT staff. I mean, that made us like, whew, breath of fresh air, right? Like we're talking about 500 employees plus however many retirees. That's a lot of people to manage. And
Absolutely.
so that made this transition as seamless as it could possibly be. And we have the support of the unions and of our employees. So we recognize that it's a slight premium increase, but at the same time, there's still more work to be done as far as making it even better for our people. But right now, given the time constraints, we think it's the best option possible. But yeah, it's been a whirlwind.
No, great,
appreciate
great
people's
job.
patience
Great,
and-
great, great. As having done it for 32 years, in the time, forget about the time frame, just in general, just great job.
Yeah, and Mike Burns has been awesome. Mike Wade has been like, man, I don't know if he's sleeping. So, but we just appreciate people's patience. But honestly, the what I've learned about Mike Burns and CGI folks and his team in the past just couple of days even is that literally they stand by their word. If you need anything, like it's just a phone call away, come by, stop in. Jackie's prepared to help people with enrollment paperwork. We've got a whole system set up for getting that transition over and done with as seamlessly as possible. And in the background, we're getting board approval and sidebar agreements written for bargaining units and policies rewritten and all of that. So nobody has to worry about that stuff. But we just want to make sure that people feel confident that they have support. And the CGI team has definitely done that. And has certainly stood by their word there. So we're happy to have created this partnership.
Mike Burns, just so you know, and you probably already know this, the reason it took us a number of years to get all the groups on the same
Mhm.
plan. But the biggest reason why we weren't ping-ponging back and forth to school care and health trust and NHIT was because NHIT, they just had a philosophy that it was like this
Mhm.
versus I remember at Anthem, we had a 39% increase one year and we ate it. This was years and years and years ago.
Right.
But it was just because,
Mhm.
there was some
Yeah.
continuity and
Yeah,
consistency.
absolutely. Yeah, it's it's sometimes it could be it's a little bit, when you're with NHIT because they had, 27 or 28 entities like SAU 9, granted a lot of them were a lot smaller. There was, they did a really good job on trying to manage that. And I just think that trends, somehow some things change. But one of the other things, Jim, I think that you'll appreciate is at CGI, again, there's about 100 of us, but in particular, we have our own internal underwriting team. We have 4 full-time underwriters. We have an actuary. Like we literally we send monthly report. Once the reporting starts flowing, there'll be monthly reports going out to Amy and Mike, and like we're tracking this every single month
Good.
through our underwriting. And we work with about 75 to 80 companies that are self-funded. So we're entrenched in this, we live and breathe it, and we love it. It's what we do. And we fortunately have an owner who cares a lot about communities. We're big into helping out, especially. I always say that I work with a couple of larger behavioral health centers in the state. And CGI, we work with most of them. A couple of them I personally work with, and it's like a school district, right? You want to do everything you can because, like, I mean, they're our community. I'm assuming we're not being recorded now, but I'm also, I'm the co-chairman of the board for CASA. That's a big deal. It's like